What I think really helped us with the outcomes that we have achieved is that we have this strong foundation of peoples and partners that are willing to work with us. The staff is there to assist, but it is so community driven, and we've been able to really do this work that the community owns and sees as their own project.
Our permanent prescription drug take-back program really is sustainable. Besides getting data back from our law enforcement, we don't have anything to do with that anymore. They set the policies, they set the procedures, and they're full off and running with that in our 3 law enforcement departments.
All the coalition basically did was got us started in that, and our police department took that over from there. And that's how it's got to be in a coalition. They help us get it started, and then it's up to us to keep it running and to make it work.
With prescription drug safety, our pharmacists and our doctors have taken that on as their own, and they're doing that at each point of contact. One of our pharmacists goes to different groups and talks about it without us asking him to do that. So he's a key sustainability piece to the education.
I think many times we as healthcare providers may not even know that the problem exists until it's brought to our attention. For example, I had given a presentation to a local dental group. We have a controlled substance monitoring database in Tennessee that providers can look up to see where patients have gotten these controlled medicines filled. The dentists weren't as aware of this thing as a tool to help to curb this. In educating these dentists about this, I told them about the database, how to look the patients up in this database to find these potential abusers, and then just to let them know that maybe the quantities you write for could be changed, and even that simple act could decrease some of the diversion right there.
One of the reasons that the coalition hired me was to create the lead group, which is our high school arm of the coalition. And we meet with them at least once a month. When the coalition does something, a drug take back or something like that, we invite them to come along. When we do initiatives in schools and campaigns, we invite them to design the material. And then we run it through does it fit? Does it work with what we're trying to get done? And that's so they drive those ideas. They drive most of those things.
One of the things that I do working with the school system is as a connector between the coalition and the schools, I've got access to data. Working with central office, I've got access to personnel that can approve some things fairly quickly. So that's been a good position for me to be in, helping the coalition over the years.
I think that the coalition and the staff have been successful because they found not just people from each sector, they found the right person from that sector. They've allowed an environment of discussion that permits people to voice opinions and find a way to move forward with everybody's support.
And it really took getting to know what we call dating our individual partners and spending time with them. The odds are staff aren't always going to be there, but if you have these partners at the table, they're going to sustain these projects. And when they understand it and they own it, then you have a lifelong organization.